Hi there, it's Dr. Mashhood from Emergency Medicine. Today we're going to talk about a very important topic, which is head injuries in infants and young children. Working in the emergency department and working as an emergency physician, every day on my shift, I tend to see a lot of children being brought in by their parents with sustained head injuries, and majority of these children we tend to examine and discharge them home with some advice and guidance, and do not do any CT scans or any imaging. Children tend to sustain a lot of head injuries just because they're in a growing age. They're trying to learn to walk, especially the infants or the young children. They play a lot of sports. So sustaining a head injury is sort of a normal process of their growth. But there are different types of head injuries. As a physician, we try to classify them as being mild, moderate, and severe. In this video, we're going to just focus about the mild head injuries. What are the signs and symptoms, what we need to look for, when to bring them to the emergency department, and when to think about getting a CT scan of the skull or the head. Now, children are different to adults in two reasons. The head occupies the largest part of the body, especially in the infants and young children. So when they tend to fall onto the head because that's the heaviest part, as opposed to adults. Secondly, even a very minor head injury in children or infants can lead to significant drastic consequences because of the fact that, especially in infants, the bones are not completely closed. The skull bones are not completely fused or joined together. They tend to join together at a later age. So when the bones are not joined together, and if they sustain a head injury, the impact to the brain is much greater compared to when the head injury happens in adults. When we talk about infants and young children, and especially when we talk about head injury in them, we talk about two important facts. These two important facts determine what sort of head injury the child is going to have. The first one is the mechanism, and the second one is the height of the fall. Obviously, if it's a significant mechanism like road traffic accident or fall from a significant height, those are the children we're not talking about today. We're talking about children who have a simple mechanism of fall, or they've fallen from a small height. But mechanism of fall in a mild head injury, the most important to determine is, has your child fallen onto a hard surface or a soft surface? By a soft surface, I mean a carpeted floor. If a child falls on a carpeted floor, the impact of the fall is not going to be that great compared to when a child falls on a very hard surface, such as a cement or a tiled floor. The injury they will sustain in the head is going to be far greater compared to when they fall on a carpeted floor. Secondly, the height. If a child falls from a small height, for example 1 to 2 feet, that won't cause much of a head injury compared to the fact that they've fallen from a significant height, such as 6 feet or more than a meter. For example, if I'm a 6 feet tall guy and if I'm holding a child, if the child falls from my hand, they are probably going to fall from approximately more than 4 to 5 feet. So that by itself becomes a significant mechanism of fall. The second thing is, when the child falls, there are certain signs and symptoms you need to look for. If they are present, you have to take your child to the hospital. But if they are not present, we're going to talk about what things you need to look for. In infant, if they are very irritable after a fall, or they have a very high-pitched cry, then they have to be taken to the nearest emergency department. Similarly, if their feeding becomes really poor, they're not feeding like they were before the fall, or they have a very bulging fontanelle, then again a visit to the emergency department is highly recommended. By the bulging fontanelle, I mean there are spaces, especially in an infant or a young child's skull. When you feel them, there are spaces in the skull which are very soft to press. Those are called fontanelles. These are the spaces which will normally be covered by the bones, which become closer together and they tend to join up. But that happens at a later stage. So So if you press that fontanelle and they're actually bulging out, that means there are significant head injury, which is causing a lot of fluid or blood in the skull, which is pushing those fontanelle. So if that is present, then you need to take your child immediately. So just to summarize, in infant, if they are becoming more irritable, or they have very high pitched cry, or they tend to have a poor feeding, or the fontanelle becomes really bulging, then they have to be taken to the hospital straight away. When we talk about children's, the signs are slightly different than to the infants. In children's, what signs symptoms, what you should be looking for is nausea, forcible vomiting, headache. An elder child can tell you if they got blurred vision or the vision is disturbed, or inability to follow simple commands. If any of these are present, then they have to be taken to the emergency department. So just to summarize, in infants, it's the irritability, poor feeding, not following simple commands, bulging fontanelles, and high-pitched cry. And in children's or a young child, it is the nausea, forcible vomiting, a headache, blurred vision. If any of these are present, they have to be taken to the emergency department. There's no question asked. If after a fall, which happens in majority of the infants in young child, if none of the above are present, then what are the things you need to do? There are a few signs and symptoms you need to look for. Obviously, the ones which I've just stated. Along with them, the first thing you need to look at the child and assess, is my child behaving normally? Now, whatever that normal could be for the child or the infant, if they are not behaving normally, that's a sinister sign, that's a dangerous sign. Then you have to get medical expert help straight away. So behaving normally, it's different for different infants and child. So you have to assess if the child is behaving normally. That's a very, very reassuring sign. If they're not, then you need to seek medical help. The second question you need to ask is, the infants or young child cry. They cry at anything. But if the cry is not normal, or they are crying excessively, or they have a high-pitched cry, then you need to worry about. If none, if it's a normal cry, normal pattern of cry, that's fine. After a fall, the first 4 hours are extremely important. In those first 4 hours, if none of the signs mentioned are present, then you need to observe the child. If the child falls asleep, that's absolutely fine. But if, especially first 2 hours after the fall, you will have to wake the child up every half an hour to assess whether they are being aroused normally or not. If they're being responsive on waking up, that's absolutely fine. After those 2 hours, the next 4 hours, you need to wake the child up every hour and make sure they are responding appropriately upon waking up. After the first 6 hours of the fall, the chances of having a significant head injury without any sign of symptoms are almost none or non-existent. Although there are case reports, it can happen, but for a child or infant to have a head injury without any sign of symptoms is very unusual. Now the question comes, when do we do a CT scan? Now CT scan, especially in infants and young children, is a controversial issue. Because we know there is some evidence out there that exposing a child to a CT scan radiation or imaging has dire consequences. It can lead to certain things which none of us as parents want a child to go through. So less exposure, less radiation is better. And now there are different parts of the world where this concept doesn't work. They just want to get a CT scan straight away. But those are not the places we're talking about. We're talking about parents, responsible healthcare institutions, where we have to weigh the risk and benefit of exposing a child without any sign and symptoms to a CT scan, and then accepting those risks of exposing your child to radiation. Now, there are international guidance for it. Different parts of the world follow different guidance on when to scan a child with a head injury. But I'm just going to mention two important international guidance. The first one is from UK. It is also called NICE NICE, National Institute of Clinical Excellence guidance on head injury in children. The second one is PECARN, PECARN. This is a guidance from North America. When we talk about the NICE guidance, there are a few things the NICE guidance mentions that if they are present, then the child needs to have a CT scan. And those are pretty more specific to the medical professionals. The first one is if a medical professional suspects the child has been subjected to a non-accidental injury or abuse, then a CT scan becomes essential. Second one is if there is a history of seizure or a jerking movement after a fall with a head injury in a child which does not have a history of epilepsy, then a CT scan becomes essential again. Then the GCS, Glasgow Coma Score, if it's less than 15 at 2 hours, needs a CT scan. If you suspect if you suspect an open skull fracture or a basal skull fracture, a CT scan becomes essential again. And in less than 1 year old, if there is any bruise, swelling more than 5 centimeters on the head, again CT scan is necessary. If none of these are present, then we go down the pathway of NICE guidance. And what the NICE guidance then mentions is if any of these 5 are present, then you might consider having a scan. These 5 points are if there is any loss of consciousness for more than 5 minutes, amnesia of greater than 5 minutes, abnormal drowsiness, 3 or more discrete episodes of vomiting. Remember, they mentioned 3 or more discrete episodes of vomiting. And the last is a dangerous mechanism of injury, such as a road traffic accident or a fall from more than 5 meters. If any of these are present, then you do a CT scan. If not, then you can observe the child for 4 hours and see how we go. The guidance from North America is a bit more simpler than the guidance from UK or the NICE guidance. What the North America did, they did a very large prospective study of more than 40,000 children, and they tried to make a predictive scoring scale about which children needs to have a scan and which don't. If they mentioned about 6 points, this study is published in 2009 in Lancet, which is a very reputable journal. It mentions about 6 points. If any of these are present, then a CT scan becomes important. If none of these are present, then you can wait and observe the child without doing a CT scan. So what are these points? The first point is we need to assess if the child has a normal mental status. Second is if there is no loss of consciousness. Third, no vomiting. Fourth is whether there is mild or moderate mechanism of injury. The fifth is no clinical signs of basal skull fracture. And the last one is no severe headache. If none of these 6 are present, then a CT scan is not necessary. But if any of these are present, then a CT scan needs to be done. So in this video, what we talked about, we not talked about moderate or severe head injury because we're going to cover this topic in a separate video about what things needs to be done for moderate and severe head injury. We've just mentioned about very mild head injury, which children or infants do tend to sustain more frequently than not. What signs you need to look for? What signs, if present, you need to take the patient or the child to the emergency department straight away? What guidance is there to consider CT scan in the children and infants based on evidence-based practice? All of these I mentioned in the description below. You can go through it. If you have any questions or comments, please mention in the comments below. There is a group on Facebook with the mention of all-rounder mummies. It's a very informative group, especially for the young parents or the young moms out there. I have sent the link on the description below. So if you're interested in getting updates on how to deal with child issues, please subscribe or follow that Facebook page. Hope you like this video. Thank you very much.